Good morning. I appreciate everyone attending this morning, and I would like to introduce myself. If I haven't met you yet, my name is Dennis White, and I am the Group Division President here. It never fails to amaze me that anytime we mention group benefits, there's always someone in the crowd that says, "What? I didn't know I had that option with Messer Financial Group." And I'd like to clear that up if I could. So if I've never met you before, we've been working with employers and putting in group health plans since 2003. We have a very good retention rate. As a matter of fact, we even have the first group on the books that we wrote in 2003, so very proud of that. We do a good job with servicing. We're a turnkey agency, so literally we'll go out, we'll meet with the employer and or the decision makers. Lord willing, we'll close the group for you. We'll service it throughout the year, and along with the renewals, we're giving them carrier options along the way, not to mention creative plan designs. So we want to be your source. If you haven't already used us for that, we would like to be your all source for group medical in any way. If you'd like to know more about it, if you have an opportunity, if you happen to know a decision maker out there and think, well, maybe I can turn this into commissions, please go to messerfinancial.com, pull up the contact sheet, and you've got my information there. I look forward to hearing from you and look forward to assisting you moving forward. And now, at this time, I would like to introduce Sandy Detlich. She is the VSP account executive and will be one of your points of contact. If you're not familiar with VSP, they are the leading provider for eye care services. They have over 65 million members, and their satisfaction rate is consistently above 95%. They have the largest private practice network with more than 30,000 doctors and more than 50,000 access points. We at Messer are excited to have them as part of our preferred vendors, and at this time would like to turn the microphone over to Sandy.
Thanks very much, Dennis. It's a pleasure to be with all of you this morning. Thanks very much for attending and getting some new information on a new benefit offering that you have for your clients. Just a little bit about myself. I've actually been with VSP for 13 years. Prior to that, I spent 20 plus years in the employee benefits field, both with pension plans, cafeteria programs, health insurance, worked with a number of brokers. So I do have a very good understanding of what your challenges are on a day-to-day basis, and I think that this program is going to really help you in your relationships with your clients, and looking forward to working with all of you. Just a little bit about VSP Vision Care. We are the only national not-for-profit eye care provider in the nation. And basically, not-for-profit means that any money that does come back to VSP goes back directly into our systems to provide additional benefits for our members, additional benefits for our doctors, and certainly for the community. We have a number of charitable programs that we're very involved with, both nationally and internationally. We've been in business over 58 years, helping people see well and stay healthy, which is our main concern. And we now have more than 65 million members nationwide. 1 in 5 of your neighbors has a VSP program. We also are international. We now have 5 million members in Canada, the UK, and Australia, and we're going to be moving into Ireland very shortly, as well as a couple of other European countries. That pretty much makes us consumers' #1 choice in vision care. With that many members, they must know something. And we have the best doctors. That certainly plays a large part of it, where our doctor network is the best program available. And our member promise guarantees all VSP members that we will make it right. Our services with VSP doctors are guaranteed 100%, and you'll be happy once they get their services. This is probably my favorite marketing piece, why everyone needs a vision care program. Not always on the forefront of why should we put in a vision program. The little graphic on the side shows that 1 in 10 Americans will get their preventive health screenings, meaning an annual physical, to look for potential problems, high blood pressure, high cholesterol, things like that. What we found is that members that have access to a VSP program will actually see their VSP provider for that annual well vision exam 6 out of 10 times, thus increasing the amount of preventive health care actually that members have taken advantage of. Through a comprehensive eye exam, our doctors can actually detect very early signs of many chronic diseases such as diabetes, high blood pressure, high cholesterol. And we've actually learned from the American Diabetic Association that diabetes or pre-diabetic conditions can actually be determined 7 years before symptoms actually appear through this comprehensive eye exam, because the doctor is able to see those subtle differences in the blood vessels in the eye. So vision care is a very important benefit to offer your clients. So now that you've convinced your folks that you need to put in a vision program, what is really important to consumers? Jobson's Research conducted a managed vision care survey back in 2012 regarding consumer perceptions of what is important in a vision program. And the overwhelming response was, we want low out-of-pocket costs and savings at the time of service. Distant second is access to all provider types, meaning private practice doctors, retail locations, and the others fall in line, ability to go to many different locations, customer service, and so forth and so on. How we do that is with our Signature and Choice plan. Our Signature plan is our flagship program. That is the program that we started with. Members save about 35 to 40% on lens enhancements. There is no other vision plan on the market that compares to our Signature plan. Because there is an awful lot of competition out there, our Choice program was developed a few years ago. It's a hybrid of the Signature plan, and it's pretty much the go-to plan and the plan that I would recommend that you use for most of your clients. Members still save 20 to 25% on lens enhancements, and there is about a 20% price differential in premium between the Signature and the Choice program. So definitely, if you're in a competitive situation, the Choice program is the way to go. Minimum participation for all of our programs is 5 enrolled employees. In your travels, you may see 10 minimum enrolled for many of our programs, but because we have a special relationship with Messer Financial, we are allowing you to enroll groups as few as 5 employees. Oops. Funding methods. I thought I would go over this a little bit because it is a little bit different than what you may be used to in the health and dental field. We don't necessarily use the terms contributory and non-contributory for our purposes. Anytime a member is offered the option to waive the vision program, that essentially makes it a voluntary offering in our estimation. But we do differentiate that by amount of employer contribution, if any. So we have the 0 to 24% or the true voluntary offering. Then we have a voluntary offering assuming a greater than 25% employer contribution. And then when we get to the core funding, 75% or more employer contribution, or 75% participation of eligible employees with that minimum of 5 enrolled, or if the vision program is actually packaged with the medical or dental program on a joint enrollment basis, then they would qualify for those core rates as well. Our plan designs. All of our programs contain a comprehensive well vision exam every 12 months. Lenses, including contact lenses or replacement lenses in a frame every 12 months. And frames are available every 12 or 24 months depending on the plan design. We also have a number of split and total copay options available, and the prices vary between those different options to get the fit that you need for the clients that you're dealing with. The vision benefit for corrective vision wear is either a pair of glasses or contact lenses. We provide a $130 allowance for frames, and that is based on a wholesale amount, so members are assured of the best consistent pricing wherever they go to a VSP doctor. They also qualify for a $20 additional allowance when they purchase our featured frame brands at a VSP doctor, and I'll talk a little bit more about those featured brands a little bit later. In addition to that, they get a 20% discount on anything over that allowance, so they are certainly getting a very good benefit through our program there. If the members decide that they want contact lenses instead of a pair of glasses, we provide a $130 allowance for contact lenses, and that's available for any contacts out in the market. We don't provide a formulary or a tower. That's a $130 allowance for hard, soft, daily disposable, weekly disposable, whatever $130 will purchase. In addition, if a member does need the separate fitting and evaluation that goes along with contact lenses, we provide that coverage with a maximum $60 copay. So they'll possibly pay less for a standard fit and evaluation if they, less than $60, or in the case of a premium fit, they will never pay more than $60. And I understand from some of my colleagues that sometimes those premium fit evaluations can range as much as $150. So they're definitely getting some good pricing there. This sample savings shows how folks really do save with a vision program at VSP. Without a vision plan, some of these national average costs for an eye exam, $152, frames, $150, single vision lenses, $84, anti-reflective coating, $108. Transition lenses are the lenses that go from light to dark, not needing a pair of sunglasses, so when you walk out the door, they turn into sunglasses. They don't have an annual premium on board, but their total cost there would be $595 on the open market. When members have a VSP choice plan in place, they now have a $10 copay towards their eye exam, and the remainder is covered in full. Frames and single vision lenses are covered with a $25 copay, and now the anti-reflective coating and transition lens cost is at a special discounted rate through a VSP doctor, so their costs there are less. And if they have chosen their VSP program, they do have an annualized premium for an employee only of $99.48. So all told, this member is now paying $257.48 for that benefit, or a savings of over $337 for the VSP doctor. This is a little bit intimidating. There's a lot more information on this on our website, but definitely just wanted to go over quickly with you the real cost of vision. And what this shows is that if a member purchases a Ray-Ban frame, and we've also included the progressive feature, meaning the no-line bifocal, so there's not that visible line between the prescriptions, also added anti-reflective coating, and that cost is at without insurance. If that member goes to a VSP provider or some other independent eye care provider, they're going to pay $649 for that particular pair of glasses. If they go to Pearl Vision, Sears, Target, or the well-known lens crafters, they can be paying twice as much for that same exact frame and lens at a retailer without a vision program in place. Now, the blue lines show what their cost would be with a vision plan. The first two bars there being a VSP signature plan or a VSP choice program, and those costs are basically the copays and the special pricing that they get on those lens enhancements for the progressives and the anti-reflective coating. Now if they go to an independent eye care doctor with another insurance plan, they still have a relatively low cost, but still higher than VSP. And if we go up the line again, even at lens crafters with a vision plan in place, their costs are $577 more than what they would pay at a VSP doctor. We certainly have the best provider choices available for members. VSP private practice doctors are our largest network in the country. They are all full-service providers, and we have the highest credentialing available for all of our doctors, so they are all very well qualified to practice. We also provide a retail chain option for members. This would only be available for groups with 10 or more enrolled employees, and this gives folks the option to go to Costco, member under VisionWorks. I believe that's still under some different names in several different states, but VisionWorks is the umbrella program there. Cohen's on the Eastern Seaboard, a couple of other programs, but members can go to these retail chains and get the same benefits that they have with a VSP private practice doctor, with a few exceptions. Costco is already a wholesaler, and so their $130 retail allowance actually equates to a $70 allowance at Costco because they've already discounted that to the wholesale price. Members can also access benefits out of network. We do have a direct pay relationship with Walmart and Sam's Club that does enable members to let them know that they have a VSP program in place, and Walmart and Sam's will actually file that out-of-network claim on the patient's behalf and take into consideration copays and any overages. Other doctors also, members can submit for reimbursement, and the proposals that you pull from our website for your clients will indicate what those out-of-network reimbursements would be if members do want to go out-of-network. This is a great flyer that talks about some of our value-added benefits. The first item speaks to our additional $20 allowance that is available when members purchase BB, Calvin Klein, Lacoste, Michael Kors, Nike, about 20 different brands available under that, where members can actually get an additional $20 allowance and make that $130 allowance $150. Another unique benefit to VSP is our True Hearing discount. True Hearing is a membership firm that provides hearing aids and professional services. Free membership is available to VSP members as well as parents and grandparents. So VSP members can sign up parents and grandparents for this great discount and can get savings of up to $2,600 on those hearing aids. Quoting VSP. There will be links available through Messer Financial Group website that will direct you to our broker portal at VSP.com. You may register at VSP.com for that broker portal, and once you do register, you will receive the licensing materials to sign up as a broker for VSP. You do not have to complete that immediately. You can certainly quote programs and get information through that broker portal without completing the licensing right away. But as soon as you do submit your first piece of business, then our commission administrator, if you haven't already completed it, will reach out to you to get that, but it certainly won't delay the group application at all for you. Depending on the state that you actually do business in, you will have different VSP account executives. I will handle all of you folks based in North Carolina. Tricia Martinez is our representative that handles South Carolina. Tricia also handles part of Georgia, along with Lisa Morgan, and Lisa actually handles 3 counties, Cobb, Fulton, and Gwinnett. And I believe all that information will also be available for you on Messer Financial to get you to the right folks. Tennessee is handled by Carrie Miller, and Mississippi is handled by Coney Wohler. And if we ever get some additional states on board, then we will certainly expand that to include some other account executives as well. And I will certainly be your contact initially, and anytime you have any questions, I'm always available to assist you, and my contact information is definitely available there on the Messer Financial website. New group setup, very, very simple. We have a complete the group master application, complete the dependent tracking membership form, which is basically a census enrollment. We do not require enrollment forms. However, we do provide a sample form if you need something for the group, if they want something for their records to confirm who's enrolled in the Vision program, but we don't need those back. All we need is the completed master app and tracking census submitted to Messer Financial 10 days prior to the effective date. We can only make plans effective on the 1st of the month. So as long as we get that by the 20th or so of each month, we will be able to get that in for you for the 1st. We don't really have a drop dead date, so even if you do get that submittal in a little bit late, we can go ahead and do a retroactive effective date for any of your groups if need be, or an on-the-spot 2-day turnaround if we need to. But 10 days will certainly give us plenty of time to get that in for you. And the bonus is you don't have to collect any money up front. We will bill for the first month based on the initial enrollment received, so you don't have to worry about collecting any dollars up front. So what's next? Once the plan is installed, you and your clients will have 2 contacts to assist you with the management of the account and the renewals. Our service support team will be able to assist with billing, membership, supplies, any general day-to-day questions. A VSP client manager will be assigned based on the state and also the number of enrolled members in the group that you submit with us. So a client manager will be assigned that will assist with renewals and benefit plan changes, and that information will be provided in the welcome kit that the member receives, or that the group benefits administrator receives once the group is installed, and you'll also receive that information. The benefit administration site is available to all benefit administrators. They'll be able to register online as well and do all of their membership changes directly online. They can pull billing, they can pay online. That's available to them 24/7 and updates in real time. So if they have maybe forgotten to enroll a member at some point in time, they'll be able to add that member immediately and it'll show up in their system. One item I did want to point out is our Get Fit Wellness program. A lot of smaller groups don't have access to wellness programs because they just aren't big enough to get into those types of setups, but we provide our own in-house Get Well program to the benefits administrators. They can set up a program directly through their source and get their employees signed up for newsletters and additional information. You as a broker can also obtain online access to administer on behalf of your clients, and there is actually a section on the first page of the group application where you can include that information. Benefits are a super snap to use. Member contacts VSP provider, member receives care, member pays for non-covered services. There's no claim forms or paperwork. Members can easily find a doctor at VSP.com, or they can always call our toll-free customer service, and they'll be able to assist them in finding a doctor and making an appointment. This is a picture of our landing page. The first tab defaults to the member screen, so members will be able to register at the site. Benefits managers for administration, and then your broker portal will also be available on this landing page, and you'll be able to click there. Online member services. Once members are signed up for VSP, they can go out to our website and register. They'll be able to view their benefits. They'll be able to find a doctor. They'll also be able to view their VSP savings statement, which tells them exactly how much they saved when they went to the VSP doctor and got their services. Lots of information on eye care, certainly information on the rebates and special offers that we talked about before. And they'll also be able to print out an individual member ID card. We don't actually issue individual ID cards because it's really not required for services. All they have to do is let the VSP doctor know that they have a full service vision program with their employer at VSP, and the doctor takes it from there. So very simple process for members as well. Then finally, the renewal process. We issue 2-year contracts, so once you have a vision program in place for your clients in 2014, you won't have to talk to them about it until 2016. Renewal letters are sent to the client 120 days prior to the renewal date, and a copy of that renewal is sent to Messer Financial and to you as well 7 days prior, so you'll have notification of that renewal 7 days before your client. Renewal is automatic. There is no signature required, and we only need to be involved with you if you have any alternatives that you want to look at, or if you're declining the renewal in any way. That is pretty much VSP in a nutshell, and I will now turn it over, I think, Dennis, if you have any questions or if you've gotten some questions from your folks.
Yes, and they've been very cooperative so far, and I appreciate everybody doing so. We've only had 2 questions, and they were in the same line. Is this available for individual sale? And no, this one here is specific to group, but I would recommend that if you've got individual opportunities out there, please call one of our marketers here at Messer Financial Group, because we do have plans specific to your state. I think Humana comes to mind as one of them, but to make sure that you're doing what's best for your client, just contact one of our marketers, and we do have individual products for you to sell as well. So with that, are there any questions? We'll just kind of open it up here for a minute. And it's been relatively quiet, Sandy, so you did a good job.
Okay. Hopefully that means that I answered everybody's questions. I hope I didn't put anybody to sleep.
So far, so good. I think it was interesting, and we're looking forward to moving this product.
Excellent. Look forward to working with all of you. And again, I'm available for any questions. Please feel free to reach out anytime I can be of assistance.
Sandy, a couple of them are coming in now.
Okay.
Are the cost allowances on individual plan the same as the group plans? I think they would be different, Sandy, unless you've got something you'd like to add to
that. You mean on an individual plan?
Yes.
Okay, and I believe, well, depending on where they go for that individual plan, because we're talking about the group insurance.
Sure. Let me just add to that a little bit more, if I could, then. Jerome, basically, if you'll contact your marketer, we'll look at what's best for them, because who knows, it could be the individual cost allowance could be better on the plan in your area. Let's see, we've got, there's questions on the commission schedule. We'll get that information out to you guys shortly. And let's see, what's the minimum group size? Sandy, 5. I think you covered that twice, did you not?
Yes, well, minimum group size is 5 enrolled employees.
Okay. So Earl, that should take care of you. And it looks like that's it. So Sandy, we appreciate your time today. All the agents that tuned in, we thank you for tuning in with us. We look forward to doing business with you. And thanks, everybody. Have a great morning.
Thank you. Good luck, everybody, and hope to work with you again soon. Take care.
Thank you.
Bye-bye.